Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery digestive system part 9b. In the current session we will be discussing the topic intestines. Under intestine you will be discussing endoscopy and the CPT range is 443602 44799. First of all, coming to endoscopy small intestine. The CPTs for endoscopy small intestine come under the range 443602 44379. Now, whenever the bleeding occurs, this is common for all endoscopic procedures. Whenever the bleeding occurs as a result of endoscopic procedure, control of bleeding is not reported separately during the same operative session. Antegrade transoral small intestinal endoscopy. Antegrade transoral small intestinal endoscopy, which is nothing but enteroscopy, is defined by the most distal segment of small intestine that is examined. It is defined by the most distal segment of small intestine that is examined. And the codes 44360361, 363, 64, 65, 66, 69, 70, 72 and 73 are endoscopic procedures to visualize the esophagus through the jejunum using an antegrade approach. Visualize the esophagus through the jejunum using an antegrade approach. And whereas the codes 44376, 77, 78 and 78 and 79 are endoscopic procedures to visualize the esophagus through ileum. Previously it is jejunum. Now it is ileum using an antegrade approach. If an endoscope cannot be advanced at least 50 centimeters beyond the pyrolus, you need to see 43233 to 43235 to 43259 and 43266 and 43277. And if endoscope can pass at least 50 centimeters beyond the pylorus but only into jejunum, then you need to refer only 44360, 361, 363, 64, 65, 66, 69, 70, 72 and 73. And to report retrograde examination, we are discussing only about anterior grade above, and to report the retrograde examination of small intestine via anus or colon stroma, use 44799 unlisted procedure intestine. The next point is do not report 44360, 361, 363, 364, 365, 66, 67, 69, 70, 72 and 73 in conjunction with these following CPTs. And do not report 43376, 44376, 44377, 44378, 44379 in conjunction with these following CPTs. And for esophagogastroduodenoscopy, C 43233, 43235 to 43259 and 43266, 43270. Now coming to the first CPT, that is 44360. It deals with small intestinal endoscopy, enteroscopy beyond second portion of duodenum, not including ileum. Second portion of duodenum, not including ileum. Diagnostic including collection of specimens by brushing or washing when performed. And the next is 44361. All these things, they come under small intestine endoscopy, enteroscopy beyond second portion of duodenum, not including ileum. If it is performed with biopsy, single or multiple, the CPT is 44361. If it is performed with removal of foreign body, the CPT is 44363. If it is performed with the removal of tumor or tumors, polyps or other lesions by snare technique, it is given by 44364. And if small intestinal endoscopy, enteroscopy beyond second portion of duodenum, not including ileum, if it is performed with the removal of tumor, polyp or other lesions by hot biopsy forceps or bipolar cautery, the CPT is 44365. And if it is controlled with the control of bleeding, example by injection, bipolar cautery or unipolar cautery or laser, heat probe, stapler, plasma coagulator, any method, the CPT is 44366. And if it is done with ablation, previously it is removal, now it is done with ablation of tumors, polyps or other lesions not amendable to be removed by hot biopsy forceps, bipolar quadri or snare technique, then the CPT is 44369. If it is performed with transendoscopic stent placement, including predilation, it is given by 44370. If it is done with along with the placement of percutaneous geogenostomy tube. For example, the complete description of 44372 is small intestinal endoscopy, enteroscopy beyond second portion of duodenum, not including ileum, with the placement of percutaneous geogenostomy tube. The CPT is 44372. And if small intestinal endoscopy, enteroscopy beyond the second portion of duodenum, not including ileum, if it is done with the conversion of percutaneous gastrostomy tube to percutaneous geogenostomy tube, the CPT is 44373. And for fibro-optic geogenostomy through stoma, use 43235. Next, coming to 44376. Small intestinal endoscopy, enteroscopy beyond. Previously also beyond second portion of duodenum. Previously it is not including ileum, but now the series include ileum. Small intestinal endoscopy, enteroscopy beyond second portion of duodenum, including ileum. Diagnostic with or without collection of specimen by brushing or washing, the CPT is 44376. If it is done with biopsy, single or multiple, the CPT is 44377. If it is done with control of bleeding, it can be any method: injection, bipolar quadri, unipolar quadri, laser, heat probe, stapler, plasma coagulated, the CPT is 44378. If it is done with transendoscopic stent placement, also includes the predilation, it is given with the CPT 44379. Now coming to the next topic, that is endoscopy stromal. And the CPTs for endoscopy stromal are in the range 44380 to 44408. Let us see some of the definitions before going into the CPTs. The first term is proctosigmoidoscopy. Proctosigmoidoscopy is the examination of rectum. Procto means rectum. We know that procto means rectum. Is the examination of rectum and may include examination of a portion of sigmoid colon. Hence the term proctosigmoidoscopy. The next is sigmoidoscopy. It is the examination of entire rectum, sigmoid colon, and may include examination of portion of descending colon. The next is colonoscopy. Colonoscopy is the examination of entire colon from rectum to the cecum and may include examination of the terminal ileum or small intestine proximal to an anastomosis. The next is colonoscopy through stoma. Is the examination of the colon from the colostomy stroma to the cecum or colon small intestine anastomosis, and may include the examination of terminal ileum or small intestine proximal to any anastomosis. When performing a diagnostic or screening endoscopic procedure on a patient who is scheduled and prepared for a total colonoscopy, when performing a diagnostic or screening endoscopic procedure on a patient who is scheduled and prepared for a total colonoscopy, if the physician is unable to advance the colonoscopy to the cecum or colon small intestinal anastomosis due to unforeseen circumstances, report 45378 for colonoscopy or 44388 for colonoscopy through stoma with modifier 53 and provide appropriate documentation. If the physician is unable to advance the colonoscope to the cecum or colon small intestine anastomosis due to unforeseen circumstances, then when performing colonoscopy, report 45378 along with modifier 53, and when performing 44388, report for colonoscopy through stoma Append it with modifier 53 and provide appropriate documentation. And for therapeutic colonoscopy, 44389 44407 and 45379 45380 45381 828488 and 45398 is performed and does not reach the cecum or colon small intestinal anastomosis, report appropriate therapeutic colonoscopy code with modifier 52 and provide appropriate documentation. What is modifier 52? 52 indicates reduced services. The modifier 52 indicates reduced services. And whenever if a therapeutic colonoscopy is performed, and these are the CPT range, it is performed and it does not reach the cecum or colon small intestine anastomosis, report the appropriate therapeutic colonoscopy code with modifier 52 and provide appropriate documentation. And modifier 52 is given for reduced services. The next is report ileoscopy through stoma. Report ileoscopy through stoma and the CPT range is 44380, 81, 82 and 84 for endoscopic examination of a patient who has an ileostomy. Report ileoscopy through stoma for a patient, for the endoscopic examination of a patient who has an ileostomy. And report colonoscopy through stoma, which come under the CPTs 44382 44408 for endoscopic examination of a patient who has undergone segmental resection of the colon. For example, hemicolectomy, sigmoid colectomy or low anterior resection, etc. and has a colostomy. If the patient has a colostomy and an endoscopic examination is performed, then you need to report colonoscopy through stoma. That is the guideline. And for colonoscopy per rectum, see 45378, 45390, 45392, 45393 and 45398. And report, next point is report proctosigmoidoscopy, which come under the CPT range 45300 to 45372, flexible sigmoidoscopy or anoscopy as appropriate for endoscopic examination of the defunctionalized rectum or distal colon in a patient who has undergone colectomy, in addition to colonoscopy through stoma or ileoscopy through stoma if appropriate. Along with the colonoscopy through stoma or ileoscopy through stoma codes, you can also code proctosigmoidoscopy or flexible sigmoidoscopy or anoscopy codes whenever appropriate. And when bleeding occurs as a result of endoscopic procedure, control of bleeding is not reported separately during the same operative session. That is a common point. For computed tomographic colonography, see 74261, 74262 and 74263 in the radiology chapter. Now coming to the first CPT 44380. Ileoscopy through stoma. Diagnostic including collection of specimen by brushing or washing when performed. Whenever ileoscopy through stoma is performed with biopsy single or multiple, report 44382. If it is performed with transendoscopic balloon dilation, report 44381. And do not report 44381 in conjunction with 44380 and 384. And if fluoroscopic guidance is performed, use 74360. And for transendoscopic balloon dilation of multiple stricture during the same operative session, report 44381 with modifier 59 for each additional stricture dilated. And if ileoscopy through stoma is performed with the placement of endoscopic stent, including pre and post dilation and guide wire passage when performed, report 44384. And do not report 44384 in conjunction with 44380 and 81. And if fluoroscopic guidance is performed, use 74360. The next CPT is 44385. It deals with endoscopic evaluation of small intestinal pouch. Example, knock pouch, ileal reservoir, S or J. Diagnostic, including collection of specimen by brushing or washing when performed. And do not report 44385 in conjunction with 44386. And if endoscopic evaluation of small intestinal pouch is done with the biopsy, single or multiple, report 44386. And do not report 44386 in conjunction with 44385. Next CPT is 44388. Colonoscopy through stoma. It is colonoscopy through stoma. Diagnostic, including collection of specimen by brushing or washing when performed. And do not report 44388 in conjunction with 44389 and 44408. And if colonoscopy through stoma is performed with biopsy, single or multiple, report 44389. If it is performed with removal of foreign body, report 44390. And if it is performed with control of bleeding, report 44391. If it is done with removal of tumor, polyp or lesions by hot biopsy forceps, report 44392. If it is done with ablation of tumor, polyp or other lesions, report 44401. And do not report 44401 in conjunction with 44405 for the same lesion. And do not report 44401 in conjunction with 44388. Next CPT is 44394. It is reported for colonoscopy through stoma with removal of tumor, polyp or other lesion by snare technique. And if it is done with endoscopic stent placement, report 44402. And if it is done with endoscopic mucosal resection, report 44403. If it is done with directed submucosal injection, any substance, report 44404. And if it is done with transendoscopic balloon dilation, report 44405. And for transendoscopic balloon dilation of multiple stitches during the same session, report 44405 with modifier 59 for each additional stitcher dilated. And if it is done with endoscopic ultrasound examination limited to sigmoid, descending, transverse or ascending colon and cecum and adjacent structures, report 44406. And since it is an ultrasound examination, do not report 44406 more than once per session. The next CPT is 44407. If colonoscopy through stoma, if it is done with transendoscopic ultrasound guided intramural or transmural fine needle aspiration or biopsy, it includes the endoscopic ultrasound examination limited to the sigmoid, descending, transverse or ascending colon and cecum and adjacent structures. Then you need to report 44407. And since it is an ultrasound examination, do not report 44407 more than once per session. And if it is done with decompression, that is colonoscopy through stoma, if it is done with decompression for pathological distension, example volvulus or megacolon, including placement of decompression tube when performed, report 44408. And do not report 44408 in conjunction with 44388. And do not report 44408 more than once per session. The surgeon performs colonoscopy through stoma for the removal of foreign body. Surgeon performs colonoscopy through stoma for the removal of foreign body. So the correct CPT is 44390. Colonoscopy through stoma with removal of foreign body. Next, coming to introduction. There is only one CPT under introduction, that is 44500. Introduction of long gastrointestinal tube. Example, Miller Abbott. And for radiological supervision and interpretation, use 74340. And for naso or orogastric tube placement, use 43752. Next, coming to repair. The first CPT under repair is 44602. It deals with suture of small intestine, enterography for perforated ulcer, diverticulum, wound, injury or rupture, single perforation. If it is performed for multiple perforations, the CPT is 44603. The next is 44604. Suture of large intestine. Previously it is small intestine, now it is large intestine, coloraphy. Entero means small intestine. Colo means large intestine. Remember that root word. Suture for large intestine, which is nothing but colorrhaphy for perforated ulcer, diverticulum, wound, injury or rupture, single or multiple perforations without colostomy. Without colostomy, the CPT is 44604. If it is done with colostomy, the CPT is 44605. Next, coming to 44615. It deals with intestinal strichuroplasty. It can be enterotomy and enterorrhaphy with or without dilation for intestinal obstruction. The next CPT is 44620. It deals with closure of enterostomy, large or small intestine. And if the closure of enterostomy, large or small intestine is done with resection and anastomosis other than colorectal, report 44625. And if it is done with resection and colorectal anastomosis, report 44626. Example, closure of Harman-Stipes procedure. And for laparoscopic procedure, use 44227. The next CPT is 44640. It deals with closure of intestinal cutaneous fistula. And for the closure of enteroenteric or enterocolic fistula, report 44650. The next is 44660. Closure of enterovesical fistula. For the closure of enterovesical fistula without intestine or bladder resection. And if it is done with intestine and or bladder resection, report 44661. And for closure of renocolic fistula, receive 50525 and 50526. And for closure of gastrocolic fistula, use 43880. And for closure of rectovesical fistula, for the closure of rectovesical, it is enterovesical. For the closure of rectovesical fistula, C 45800 and 45805. The next CPT is 44680. It deals with intestinal plication, separate procedure. Now let us see some examples. A 45-year-old patient presents for closure of intestinal fistula. The CPT is 44640. Closure of intestinal cutaneous fistula. Next question. A 53-year-old patient suffering from perforated ulcer presents for colorrhaphy without colostomy. Colorrhaphy without colostomy. And the CPT is 44604. Suture of large intestine, which is nothing but colorrhaphy for perforated ulcer, diverticulum, wound, injury or rupture without colostomy. Next, coming to other procedures, the first CPT under other procedures is 44700. It deals with exclusion of small intestine from pelvis by mesh or other prosthesis or native tissue. Example, bladder or omentum. For therapeutic radiation clinic treatment, see radiology oncology session. Radiation oncology session. The next is an add-on code plus 44701. Intraoperative colonic clavage. And it must be used in conjunction with 140, 145, 150, 604 as appropriate. And do not report 44701 in conjunction with 44950 44960. The next CPT is 44705. It deals with preparation of fecal microbiota for installation, including assessment of donor specimen. And do not report 44705 in conjunction with 74283 and 0780T. And for fecal installation by oronasogastric tube or enema, use 44799. And for installation of fecal microbiota supervision via rectal enema, use 0780T. These are the revised guidelines, hence they are indicated by these triangles. The next is 44715. It deals with backbench standard preparation of cadaver or living donor intestine allograft prior to transplantation, including mobilization and fashioning of the superior mesenteric artery and vein. The next CPT is 44720. Backbench reconstruction of cadaver or living donor intestinal allograft prior to transplantation, venous anastomosis each. And for arterial anastomosis each, report 44721. And finally coming to unlisted procedure, 44799, unlisted procedure, small intestine. For unlisted laparoscopic procedure intestine except rectum, use 44238. And for unlisted procedure colon, use 45399. By this, we complete the intestines. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.